Hello, everybody, and good evening or good morning, depending on where you are in the world. Welcome to the Functional Solution podcast and discussion. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hey, everybody. Welcome.
And in these discussions, weekly discussions, we come together to share with you our years of clinical experience in functional, nutritional, and herbal medicine. Myself as a functional and integrative medicine practitioner, and Dr. Chill as a functional medicine physician for several years with over a decade of clinical experience. So this is something that we're very passionate about, like many of you, which is figuring out the root cause for different chronic conditions and what are some of the treatment strategies that we can offer patients to optimize their health, to feel better, to keep improving their function beyond just a prescription of a drug or a pharmaceutical. So in today's discussion, we're going to talk about a very, very important topic, which is treating insomnia and optimizing our sleep. So this is something that is so important. And the reason why it's so important is, one, because it's so common. According to the National Sleep Foundation, about 1 out of 3 adults in the United States does not get the recommended amount of sleep, which is 7 to 9 hours per night. And insomnia is probably one of the most common sleep disorders that essentially make it difficult. The patient has difficulty falling asleep, staying asleep, and with many of our patients, the quality of sleep is just not well. It's just very, very poor. And we know that it can cause sleepiness and fatigue when you're not sleeping well at night, but it can also cause mood disorders such as anxiety or increased tendency towards anger. It can also impact your overall health, work performance, productivity, and overall quality of life. And so if you're working with patients, it's important to know that about 1 out of 3 adults experiencing short-term insomnia and about 1 out of 10 adults you're seeing statistically is experience chronic insomnia and been struggling with that. So we're talking about a large number of individuals. The estimated is between 70 to 80 million adults Americans are struggling with those conditions. And of course, we know that when we refer to insomnia, we're talking about symptoms that are there at least 3 times per week for at least 1 month. We're talking about difficulty falling asleep, inability to stay asleep, waking up earlier than you want to wake up, non-restorative sleep, right? So if you wake up but you felt like you didn't sleep, you didn't have a good sleep, you're tired, you need your coffee to stay awake, daytime impairment, or if you're feeling more anxious during the day, that could also be an issue with sleep. And of course, because we are here to focus on health and function, and in our community, we have such a amazing variety of healthcare professionals, right? We got about 200 new healthcare practitioners coming into our programs every year, from physicians across the world, nurse practitioners, nurses, PAs, pharmacists, a really wide variety of healthcare practitioners. We want to focus on we want to talk about how to figure out what's causing, when you see a patient, how to figure out what's triggering their insomnia, and then what to look for, and a few treatment strategies that can help your patients that you're already seeing tomorrow. So before we get into identifying the 3 major root causes of insomnia, we and talking about the 3 top supplements that your patients can use and you can consider recommending. It's very, very important to talk about the second reason why we chose this topic for our weekly discussion, and that's the impact that insomnia, that a patient that does not sleep well, the impact on their health. So, Dr. Chill, share with us some of the implications, right, that when we're talking about insomnia or poor quality of sleep.
Absolutely. This is a really important topic. As you mentioned, 1 out of 3 adults will suffer from insomnia, and those statistics are true. This is actually what I see in the clinic. 1 out of 3 of my patients will have some sort of sleep disruption or insomnia or inability to sleep, or having sleep that isn't fulfilling, right? It's they're waking up where they're not refreshed for the day. And as you know, if you haven't slept well, your day isn't as great. Your cognitive function isn't as sharp as it should be, and you aren't at your optimal state. So this is important because we not only want to get you to your optimal state, but there's also a bi-directional relationship with many health conditions. The health conditions, and this is all according to the National Institute of General Medical Sciences, any long-term sleep loss or continually shifting your circadian rhythms, and both of those go hand in hand. If your circadian rhythm is thrown off, sleep disruptions can happen. If you have sleep disruptions, it can throw off your circadian rhythms. So any of that for a prolonged amount of time can impact and actually trigger other conditions or exacerbate these other conditions, such as metabolic conditions or cardiovascular conditions, such as obesity, diabetes, even mood disorders, heart and blood pressure, even cancer. It can worsen all of these health issues. So it's really important when you are seeing patients with any of these conditions that you ask them about their sleep and how their sleep is and the quality of their sleep, and then how we can approach it in a way to optimize their sleep, to actually even optimize these conditions for you, for them. And we'll get into the ways that you can look at optimizing their sleep for them later in this podcast. But again, this is a really important topic because it impacts so many other conditions. And then, as I was stating, it's going to impact your day-to-day life if you're not getting enough sleep.
Absolutely. And this is something that learning more about sleep is something that helped me personally, beyond just helping patients who are coming in and struggling with different, variety of sleep challenges, right? But I always remember myself as somebody who is very kind of like a night owl. I used to feel more awake at nighttime, and that was great when you're in your early 20s and you want to explore the nightclubs and dance all night and have drinks and and you feel invincible because you're in your 20s, right?
Right. But when you get to your 30s and your 40s, you're like, oh, what happened?
Exactly. And so of course, that's learning the natural cycles of rhythm and the function of the endocrine, and how, like, the more I learn about sleep and the cycles that are involved, the important factors that we're going to talk about right now, the more I understand my personal tendencies, right, for being more awake, like physiological tendencies of being more awake at nighttime, right, and then like what's happening, like why does that happen, right? When a patient walks in and tells you that they went to sleep and then they suddenly they wake up at like 2 a.m. or 3 a.m. Like, what happened? And they're awake. They can go and watch TV or read a book, right? So understanding those cycles and the hormones that are involved in that are so important, because it tells you so much about what's happening under the skin, right? And
really
I'm just blessed that I was able to learn about it, because I was able to improve my own sleep and tremendously. So I can't say that I'm a morning person, but now that I know
You're working
exactly,
on it.
I'm working on it, exactly. And now that I know exactly which supplements to take and how to organize my sleep routine, then I wake up in the morning properly and I'm functioning, even if I have to wake up really early, and so that's so beneficial to know that. So we're going to talk about 3 triggers. I'll take you guys into the first one, and then Dr. Chill is going to talk about the next one, the second one. So essentially, the first one is imbalances in circadian rhythms. And when we talk about circadian rhythms, we know that there are impacts on physical, mental, behavioral, right? There's a 24 circadian rhythm. Our inner clocks and circadian rhythm really impact not just our sleep, but we know it impacts the release of hormones, appetite and digestion, our metabolic rate and temperature. So the reason I'm mentioning it is because think about not just patients coming in with sleep problems, and not just, like Dr. Chill mentioned, patients that are coming in with challenges with the cardiovascular system or diabetes, right? We're also talking here about patients who are struggling with excess weight, right? That have different maybe addictions to sugar and sweets, and they're trying to lose weight. We have to address their sleep and balance their circadian rhythm to help them in their journey towards healthier appetite, healthier metabolism. That's really a big part of it. And so there are different factors. We're not going to get into all of them. We have like a 3 or 4 hour class just on circadian rhythm and sleep and the hormones and what impacts all of those. But I wanted to give you sort of the essence that you can take it, understand the mechanism. Tomorrow morning already help your patients. That's really our motto when we focus on the clinical side. So there's several factors, but we're going to talk about one that is really, really important, and that's melatonin. And we all heard of melatonin. And we know that melatonin levels changes throughout the day. So in this really cool picture, we can see melatonin, the dark night, as I like to call it. And you can see the average concentrations here of melatonin. And in a black line, you can see the plasma levels of melatonin, while the blue line shows you the saliva level of melatonin. And then you have the red line, which is urine level of melatonin, that essentially is measuring 6-sulfa toxin melatonin. And so there's different ways of measuring melatonin. You can measure it. The most simple way to measure it is to measure it at nighttime through a saliva test. And there are several labs that offer that. For example, Doctors Data has a lab test. The patient spits into a tube, they close it, they ship it out to the lab in the morning, and it gives you indication of what's their melatonin levels. Are they normal? Are they too low? Right? Because melatonin is so critical in regulating our circadian sleep-wake cycle, right? And so it's important to see how melatonin is literally increasing, right? We can see that melatonin is continuously increasing throughout the nighttime. And so so the pineal gland, essentially, as we reduce exposure to light around 7 to 8 p.m., the pineal gland begins to produce melatonin, secrete melatonin, and melatonin peaks around middle of the night and then continues to decline. By the way, this is why it's also important for us to be in bed and asleep during those hours. Because if we miss this window, right, we miss that 9 o'clock to 1 or 2 o'clock, we're going to miss a big part of a big section of the melatonin, the natural melatonin secretion. So think about somebody who's watching TV all the way to 1 a.m., right? Or playing video games or playing with their phone, right? That exposure to light turns down their melatonin drastically, right? And so when we optimize patient sleeps, we want to explain to them that their sleep hormone, melatonin, is secreted beginning from 8 p.m. So the earlier they go to bed, the better, right? We have supplements we can help them to relax, to ease them into sleep. We'll talk about those in a minute. And so here's the citation for this study. It's a really interesting study. If you want to read more about it, you're welcome to do so. Now, this is something that is really, really important for us to know as healthcare practitioners who are learning functional, nutritional, and integrative medicine. Beyond sleep, melatonin has multiple important functions. For example, it helps with regulating metabolism and sex drive and reproduction. And we already talked about appetite and muscular coordination. It's also, when we talk a lot about inflammation, autoimmune conditions, the root causes of those conditions in functional medicine. And so melatonin plays a very, very important role in modulating our immune system. Now, that could have a both pro or anti-inflammatory effect. So for example, during infection, melatonin is secreted to help the immune system, to trigger the immune system, to stimulate the immune system to fight bacteria, viruses, or chemical pollutants. And so I wanted to bring you this really cool picture. This is from the Journal of Cytokine and Growth Factor Reviews. And in this picture, you can see the different functions of melatonin, mostly in the aspect of the immune system, which is something that we don't talk a lot about when we read or hear about melatonin. It's mostly about sleep, right? But you can see here that melatonin has an important role in regulating or stimulating the production of macrophages, monocytes, inflammatory cytokines, right? So you can see there are multiple inflammatory cytokines that are involved in the inflammatory and natural killer cells as well, right? Some of those immune cells involved in destroying cancer cells, destroying bacteria, destroying viruses, right? Clearing viruses, but it also has an anti-inflammatory effect. So when not under infection, right, it has a strong anti-inflammatory effect. For example, on the right bottom side, you can see the melatonin leads to an increase in the levels of T regulatory cells, or Tregs. Tregs have an important role in regulating the immune system and preventing chronic inflammation. Also, it increases the expression of the anti-inflammatory cytokine IL-10. And we get into much more in depth into the different cytokines and how you can, through certain foods or lifestyle or factors or different supplements, how you can upregulate certain immune factors, immune cytokines, how you can downregulate certain immune factors. So we have a whole class, it's called Functional Immunology, and we dive much, much deeper in the advanced training into how do you turn this up, turn this down, so how you can help your patients to kind of regulate their immune function. But for now, it's important to understand the major concept, which is melatonin is not just for sleep. Melatonin plays an important role in regulating your immune system, so you have a healthy response to pathogens and you have a healthy response to reduce ongoing inflammation. We know that with inflammation and with free radicals, there's also oxidative stress, which in other words, free radicals that can play a role in destroying our cells and organs. And so melatonin has a very strong antioxidant as well. So and there's really interesting studies that came out that looking at the connection between melatonin levels and neurodegenerative conditions such as Alzheimer's, and there's some really interesting connections there. So just remember that next time you're sitting with a patient that has degenerative or neurodegenerative conditions, especially of the brain, remember melatonin. That's a very, very important compound in our body. Now, how do we make sure that our melatonin stay high? It's important to make sure that we go to sleep on time. We already looked at the graph from that particular study, but there's other factors that contribute to our circadian rhythm. For example, if the patient eats late, if there's stress, if they are engaged with physical activity in the morning versus at nighttime, what's their social environment, right? And also the room temperature, right? And so there's different factors that can impact this. But essentially, if a patient work night or they're watching TV at nighttime, if they are jet lagged, if we already mentioned exposed to artificial light, that's probably one of the worst things. If they drink alcohol, right? If they take aspirin or ibuprofen, that also reduces melatonin levels. Testosterone also reduce melatonin levels, right? So all of these can contribute to insomnia. And so the one of the best things we want to do is recommend our patients an hour before sleep to shut down all their electronics, right? And not to be exposed to light, to dim all the lights if they can, and then just read a book, listen to music, just relax a little bit before going to sleep, and make sure that our our bedroom is completely dark and the temperature is a little bit colder, right? So we don't want it to be warm. We want it to be a little bit colder. Just a tiny bit colder is better for creating an environment that stimulates more melatonin, right? Sometimes doing some deep breathing also kind of turns off our sympathetic system and allows us to enter a good sleep. And there's lots of 5 minutes breathing meditation on YouTube that are free to use. So what I would typically recommend is have like your top 3 or 4 recommendations you can make to patients when they tell you, I have insomnia, I have trouble, difficulty with sleep. Make sure that they have the right environment and all of those, as we talked about. And then there's other factors. We're going to tie it back to the second factor, but I wanted to talk about melatonin because it is so important. Now, we're also going to talk about supplementing with melatonin, and we're going to give you a couple of great recommendations to make sure that their melatonin is up where it should be, especially with older patients. Unfortunately, as we age, our ability to produce melatonin decreases. So that's something that we can significantly help with providing the right type of supplement and lifestyle. So that was factor number 1. Dr. Chill, let's talk a little bit about factor number 2. Was there something you wanted to add to melatonin or?
Absolutely. With the melatonin and the circadian rhythms and the sleep hygiene that you just discussed, right? These are actually all connected. All of these factors are connected. And when you're dealing with insomnia or sleep disruptions with your patients, you actually want to use a mix of all 3 of these different factors and look at all 3 of these different factors. As Dr. Cohen was mentioning, the sleep hygiene, right? Staying away from light before sleep, getting off your phone, getting off the TV is going to help. Shift work, if they're jet lagged, if they're drinking alcohol, if they're eating Those are all things that you can avoid to help with sleep. Now, there are times when you might have patients that do all of those things, right? Improve their sleep hygiene, but they may still be having sleep issues or insomnia or sleep disruptions. And there is a reason for that. If they have been doing if they've been doing those things for a prolonged amount of time, right? Like the shift work, they're traveling all the time, they're on their computer until 12 a.m., or they're watching TV until 12 a.m., or if they have a lot of chronic stress. All of these different stressors or this build up with chronic stress can lead to HPA dysfunction. This is another factor to insomnia. HPA just stands for hypothalamus, pituitary, and adrenal axis. What occurs when they have those many stressors for a prolonged amount of time or chronic stress, it can throw off the imbalance in the hypothalamus, the pituitary, and the adrenal. I'm going to show you through this picture. Let's pop up this picture really quick so you can understand how this works and how it impacts your patient's sleep patterns. For just before I get into that, the HPA is really responsible for creating homeostasis in our bodies, right? The normalization in our body, which deals with stress response, energy metabolism, immune function, and neuropsychiatric function. So this is your mood, this is your stress response, these are your energy, this is your metabolism, these are the different factors that can relate to other health conditions that I mentioned earlier. So the HPA axis is responsible for all of that. So when it is imbalanced, it can cause issues in sleep. And here's how it does that. So on the top of the picture here, you see the hypothalamus, right? So the hypothalamus is responsible for, or within the hypothalamus, it's responsible for having CRF, which is going to stimulate the release of a hormone that produces morphine-like effects. And you can see that the hypothalamus will trigger CRF to trigger a neuroendocrine substance from the pituitary gland, such as ACTH, to trigger something in the adrenal gland, which is cortisol. So there is a whole cascade that occurs within the hypothalamus, the pituitary, and the adrenal glands. And the things that I mentioned, right, the CRH, the ACTH, and then even the cortisol, there are neuroendocrine substances within those processes that are these neurotransmitters, such as 5-HTP or 5-HT or serotonin. And it's important to understand that serotonin is the precursor to that important sleep substance, melatonin, norepinephrine, GABA, which is a relaxin neurotransmitter, and then other endogenous opioids that can help to regulate this whole system. And it's these imbalances in these neurotransmitters that can cause sleep disruptions. And an increase in cortisol that you can see on the bottom here, when there's an imbalance in this HPA axis, is going to reduce melatonin levels. Now, I want to show you a different picture so you can kind of see how these melatonin levels and these cortisol levels are related to each other and how the balance of these can impact the other. So in this picture here, this is from the Journal of the Central Nervous System and Disease. You can see that there is a balance and an intercorrelationship between melatonin and cortisol. Cortisol in the black line there, and then melatonin in the red line there, they have an inverse relationship. So when one is high, the other is low. So for example, when cortisol levels decrease as melatonin increases, when it's time to sleep, right, your melatonin should be rising while your cortisol is decreasing. But if that doesn't happen because your HPA axis is imbalanced and is disrupted, then the inverse can happen where cortisol levels are increasing and melatonin is decreasing. And that's something that we don't want for our patients because that is going to disrupt their sleep and cause insomnia. It's important to understand this because this is a major contributing factor for insomnia and sleep disruption. And we're going to talk about, you'll get more information and more in-depth discussions on the HPA axis and the cortisol and melatonin relationship. But the reason why it's really important in insomnia is because we can actually measure these levels for our patients. Dr. Cohen mentioned a test to measure melatonin levels with Doctor's Data. Doctor's Data also has an adrenal assessment or an adrenal analysis where they can measure cortisol levels throughout the day, from the morning, the mid-morning, the afternoon, and the evening time, to see where those levels are at and to see if there are imbalances in the cortisol level, such as, let's say you do a adrenal assessment, right? And their cortisol levels are increased in the evening time. This is telling you that they have an imbalance in their HPA axis because the cortisol levels should actually be decreased in the evening time. And it is that cortisol, that elevated cortisol in the evening time, that is causing their sleep disruption. And we can actually use functional medicine approaches to balance out that cortisol levels and that HPA axis for them so it does what it's supposed to do and they can get the sleep that they need.
Perfect. And that's so important. And I'm so glad that you mentioned that, because for so many patients who are actively reading, right? A lot of our patients, and this is why my personal belief is that every healthcare practitioner should know some functional medicine and nutritional medicine, because patients today are much more involved than what they used to be 20 or 30 years ago, right? Patients today have the internet in the tips of their fingers. So they come to see you as a healthcare practitioner or one of their primary care practitioners. And if they tell you, I got insomnia, I got pain in my back, I got whatever it is, you prescribe them, but they go home and they still unsatisfied, which unfortunately many of them are, or they struggle with side effects of the medication. What the first thing that they'll do is they'll go ask Dr. Google, right? And that's not necessarily, a self-prescribing patient is not always a good thing, right? In most cases, it's not, because that's not evidence-based practice, right? They read something, they apply it. And melatonin is used, it's big. I looked at how many melatonin supplements there are, and there are hundreds of types of supplements of melatonin, different dosages and different companies, and all around the world there's so many products of melatonin. So we know that patients are reading about it, and they're buying it. The problem is that if they're taking melatonin but they're not addressing their cortisol levels, like Dr. Chill was mentioning, they have a HPA axis imbalance, their adrenal is dysregulated, they got chronic stress, whatever it is, then taking melatonin is not going to resolve their problem. They can take melatonin, but as soon as their cortisol spikes up, their stress, cortisol does what? It reduces melatonin and it increases the levels of glucose in their blood, right? So now the brain is getting more glucose. Guess what? You're more awake, right? It's hard to sleep when your glucose levels spike internally, right? So it's really important to learn how to, like Dr. Chill said, learn how to identify it, learn what some of the labs that are involved in that. We have a whole class on adrenal, measuring it like in the primary care setting, just in the morning in a blood test. That does not give you an indication of what their HPA axis is doing, right? It might be useful to rule out Addison disease or Cushing disease, but that's not, we're talking here about functional disorder, which is insomnia, right? And then looking at the HPA axis, like Dr. Chill said, is really, really important. So if you want to learn more about it, of course, we got specific classes on it. So we're going to dive into it in the functional medicine program, but just know about it because it's really important. So now we got the last, talking about the last major factor that contributes to insomnia, and that's underlying medical conditions. So there's multiple conditions. For example, we know chronic pain, that makes sense. Cancer, diabetes, right? Irregularity in blood sugar levels, that can cause issues with sleep. If they got asthma, they got GERD, right? If they eat before they go to sleep, right? That might, some patients might, it might not work well with their digestion system, right? If they got hyperthyroidism, if they got PTSD, right? It's so important to have, this is one of the reasons why it's so important to connect with other healthcare practitioners, to have somebody who can provide the appropriate support, right? So, for example, have a good, connect with with an experienced psychologist in your community. That's a great way for referring back and forth. Psychologists see a lot of patients that have insomnia because of the anxiety that involves and depression that involves in that, right? So you can refer back and forth. We're also talking about, for some patients, it could be a life coach that will give them a few good strategies to deal with factors in their life, personal, financial, whatever it is, that bring forward more stress, right? To deal with that. For some patients, it could be sleep apnea. One of the things that I love doing in my evaluation session with patient is bring the spouse or get them on the phone so we can ask them about what's the quality of life, what's the quality of sleep. And we had so many patients who said, I sleep okay, right? I'm tired, but I sleep okay. I don't wake up, I don't sleep, I think I sleep okay. And when we ask their spouse, they're saying that, no, like you're snoring heavily, like you're heavily snoring, you wake up multiple times, right? So some of them would say like, yeah, he's snoring or she's snoring, they're gasping for air in the middle of the night. So of course, talking to the partner is very, very helpful. And when appropriate, refer them to a sleep study. So there's multiple factors that we're not going to get into, but certain medications, of course, can, for example, anti-allergy medications, nasal decongestants, can stimulate the patient, right? And we know that some medication like beta blockers for high blood pressure can reduce levels of melatonin, right? So we have a whole section in the advanced program about drug-induced nutrients depletion, which is really important for practitioners to recognize when a patient is on a certain medication. It reduces certain compounds and hormones in the patient's body. So also, if the patient is taking antidepressant, it can disrupt the neurotransmitter balance. And of course, diuretics can deplete magnesium, which is essential for GABA production and can cause frequent nighttime urination. So there's multiple factors that can contribute to that. And so this is where now you understand the three major factors that we've talked about. Let's talk about what are the three supplements that can help you win this battle with insomnia, right? And these are the reason we like to talk about supplements is beyond understanding the root cause. We always want to understand the root cause, not just a quick fix, right? But also dive deeper into the root cause so patients don't continue to develop more conditions, right? We don't want to just put a Band-Aid on their conditions and manage their symptoms. We want to look into the root cause. But we also have to help the patient to sleep while we do that, while we figure out the root cause and work on it. So let's talk about the first one, the first supplement that is highly, highly recommended. So Dr. Chill, let's get into supplements and what they can take with them to help their patients.
Absolutely. It's really interesting because in my coaching call today, there was a practitioner who is a MD, a medical doctor, right? And she works in the hospital setting, and she was telling me she is seeing this increase in patients, and she's seeing this trend where her patients are asking her for other options outside of the prescription medications that she would normally give. And so that was one of the reasons why she got into this program, is because she wanted to learn all the different options for her patients and actually prescribe them or recommend them correctly. This is why we're getting into this supplementation portion of the podcast. So you have different options for your patients or your clients, and you can recommend them correctly in an evidence-based fashion. We are only giving you dosage recommendations or supplement recommendations if they have been clinically tested and there is evidence and research behind the supplementation. Now, with that stated, supplements can also be used as a band-aid for your patients, and shouldn't necessarily be used long term, because we still have to look at the root cause, as Dr. Cohen was mentioning, right? So yes, we understand that melatonin, which is one of the top supplements, and so many patients are using this supplement. We want to give you the correct recommendations for it, but this is still a band-aid for some patients. So this is going to be a great supplement to help them get to sleep while you are looking at the root cause, such as an HPA axis dysfunction, and then addressing that specific root cause, right? So this is going to help them get to sleep better, because melatonin, as mentioned earlier, is a sleep regulating hormone. And Dr. Cohen mentioned is typically produced in your pineal gland, but other factors can come into play that can disrupt this melatonin. So we can actually give them melatonin to help with that sleep. And research is showing that it is effective at addressing insomnia, sleep disorders, jet lag, shift work related sleep issues, and then even delayed sleep phase syndrome. How should you recommend this for your patients? So the dosage recommendation is 0.05 to 0.15 milligrams per kilogram, or about 5 milligrams per day. And this should be done 1 to 2 hours before dim light. And you could do this for an onset of 1 to 4 weeks to help with their sleep, and then also while you are looking at addressing the root cause of their insomnia. You also want to do some of the sleep hygiene, as Dr. Cohen was mentioning earlier, such as going to bed on time, right? Not going to the late night clubs and having all those drinks on a regular basis. You actually want to go to bed in between that 9 and that sweet spot, the 9 and 10 p.m. I've actually made a sleep as a priority for me, because I need at least 7 to 8 hours to function. And I love going to bed at 9 p.m. But there are times when I can't sleep, and melatonin has been helpful in that aspect as an as needed basis for me to help get to those sleep levels. And I've seen this actually with my patients as well. And another note on like the dosage recommendation, everyone's a little bit different on their dosage recommendations. Some people can handle up to the 5 milligrams per day, or in the evening time, but that might be too much for some people. Some people might be able to only handle 1 to 3 milligrams per day, or else anything above that may cause drowsiness for them the next day. So this is something that I actually like to do a low dose first with my patients, and then slowly increase their dosage depending on how they feel the next day, and then if it helped with their sleep. So melatonin is a great supplement, but you also want to look at the dosage recommendations. And then we also wanted to provide you some supplements that have been clinically tested and has gone through quality assurance and actually has melatonin in it. So there's two that we would recommend, or that we have used with our patients ourselves. There's one that's called Melatonin 6-hour time release by Life Extension. And there is about 750 micrograms for mild insomnia or supporting healthier sleep. That is the time release. So when we're doing melatonin and recommending it, time release is great for the supplementation because it's just doing what it states, right? It's releasing it on a delayed onset for the patients or for yourself. Another supplement is melatonin SRT. This is sustained release, and this is by Designs for Health, and the average is 6 milligrams, and this is more for moderate to severe insomnia, and this is for adults. And again, the two are the melatonin 6-hour time release by Life Extension, and then the melatonin SRT by Designs for Health.
Wonderful. So those are two really great recommendations, and you can kind of travel within that scale of, like, for some patients, the more mild dosage is going to be helpful, like the 750 microgram to 1 gram. That would say for most patients who have like very mild insomnia, like Dr. Chill mentioned, even for patients who are at an older age and they kind of want to optimize their sleep, they want to sleep better, that's great. They can go for those lower dosages. And then there is the higher dosages. Some individuals, if they have more stress in their life, or they have more moderate to severe insomnia, then the 5 to 6 milligram is more beneficial for them. So you guys have two options. Like Dr. Chill mentioned, the sustained release melatonin is trying to mimic what our body's naturally doing, which is it doesn't just push melatonin at 10 p.m. when you're going to sleep and that's it. It releases it slowly over 6 to 7 hours, right? A couple of really interesting things that I wanted to mention about melatonin, and Dr. Chill can also kind of pitch in from his experience. This is, and what I'm sharing right now is really purely from my clinical experience working with patients. I've not seen this in any particular study, so take it for what it is. And I noticed that two really important notes is, and that's one, some patients might wake up feeling a little bit sleepy and groggy if they take melatonin too late. So at that point, you can tell the patient, instead of taking melatonin before you go to sleep, take it about 30 to 60 minutes before, about an hour, 30 minutes to an hour before you go to sleep, right? As you kind of get ready to sleep. That sometimes helps. Number two is that some people, when they take melatonin, they don't react well to it because they have a problem with metabolizing melatonin. So just remember that, and sometimes it's good to give a heads up to the patient that most patients will react very positively to melatonin. Once in a while, there's a patient that will not properly metabolize it, and so they might have bad dreams or wake up, or which is the opposite. We know it's the opposite from what we want to happen, but just be aware of it. Most patients will react very positively, but that could happen if they don't. Some people don't metabolize melatonin properly. So we'll talk about two other options for them. Dr. Chill, anything that you want to add to that?
Yeah, it's really, for me, what I've seen in my clinical practice is I used to just prescribe the 3 to 6 milligrams right away, and sometimes my patients would have an issue with that because they woke up groggy. Sometimes even if they took it, at the time that they were supposed to. And so what I've done is I've just started with a lower dose for them and then worked my way up, and that seemed to really help mitigate some of the grogginess in the morning time. But I also recommended, if that happened, to take it at around like 8 p.m., as you were mentioning, right? Like a half an hour to an hour before that melatonin should kick in. And that's helped to mitigate some of those issues as well.
Yes, absolutely. So Dr. Chill has some great recommendations with slowly increasing the dose. That's one option. That's great. You can recommend them to take it earlier. If they don't respond well, for some reason they still don't respond well, we can give them the precursor for melatonin, which is either tryptophan, L-tryptophan, or 5-HTP. So essentially, in our body, tryptophan, which is coming from food, L-tryptophan, is turning into 5-HTP, and then our body's converting that into serotonin, and then there's a little bit more in the pathway, but I'm kind of summarizing it, and then it's converted into melatonin. So you can give them 5-HTP, for example, 50 milligrams or 20 or 30 milligrams of 5-HTP, and the body will take that and make more melatonin, right? So that together with B6 helps to facilitate the formation of serotonin and melatonin from 5-HTP. It's a very cheap supplement. It costs a few dollars. Great if the patient also has anxiety or depression, right? One thing to be cautious is to not combine it with certain medication like SSRIs, because they both have synergetic effect. But we dive much more into it in the advanced program, but I just wanted to kind of mention that. So here's where we're gonna dive into the second. In case melatonin is great. You can combine it with the supplement I'm gonna talk about next, or you can just move into the next one, which is valerian. So valerian root is a great herbal remedy for sleep. It's been used for hundreds of years, and it's made from the roots and stems of valerian root, essentially. Instead of the difference between both valerian and sleep medication can make you sleepy, but valerian offers a full spectrum as a plant, as plant-based supplements typically do. Full spectrum means that you also get the different types of phytonutrients and antioxidants and all of that. Essentially, there are multiple studies. There's one that we looked at a meta-analysis and systematic review. They looked at 16 eligible high-quality studies with over 1,000 patients, and they found that valerian may improve sleep quality in patients with insomnia. And so the dosage, when you look into consider valerian, the dosage typically between 300 to 600 milligrams per day, and we'll post that in the screen here. It's between 300 to 600 milligrams per day, and it's also important to know that valerian, and it is one of my favorite plants to use. I actually take valerian before I go to sleep. Sometimes if I had a stressful day, I'll take a little bit of melatonin, a little bit of chamomile, or maybe drink chamomile tea before sleep, and take valerian as a tincture, right? So I just add it to my water or juice or whatever it is before I go to sleep. And it helps tremendously to just relax the body and helps you to go into sleep. 300 to 600 milligrams, that's the dosage that we want to look into. With that being said, with some people, if they take it too late, they take too much, it can cause sleepiness in the morning. So like Dr. Chill said, you can start on a smaller dose for a few days, see how they feel. If they need a little bit more, they can increase the dose, right? They can find it in a tincture, they can find it in a capsule. It's very common. And then one more interesting note about valerian, and that's valerian at 600 milligrams and above in a particular study was found to reduce blood pressure and heart rate. It also reduces anxiety. But it's important to know that, because one, you can use it if the patient has anxiety, high blood pressure, and insomnia. Perfect. That's the perfect fit, right? To take valerian. But if the patient has tendency for lower blood pressure, For example, if they start taking valerian and they tell you that they stand up and they feel a little dizzy, you should take them off valerian, substitute it with something else, or just reduce it to 50 to 100 milligrams to make sure that, again, we're not reducing their blood pressure too much. So that's as usual. We want you to understand how it works so you can better educate your patients. And then Dr. Chill, take us through the last supplement, which is probably one of the safest ones, safest profile.
It really is. And this is actually just another option for them, right? So you were mentioning there's some patients who can't metabolize melatonin, or you might have patients who have issues with valerian root. What is an alternative that you can provide for them? Magnesium is that alternative that you can provide, because this is the fourth most abundant mineral in the human body. And this is following calcium, sodium, and potassium. But more importantly, in sleep, it's involved in so many enzymatic processes and reactions that are essential for neurotransmitter function and neurotransmitter synthesis, and neurotransmitters being neurotransmitters such as melatonin and GABA. Those are all responsible for sleep and proper sleep, right? And magnesium is responsible for allowing those neurotransmitters to be synthesized. So there is an influx of patients with magnesium deficiencies. And if you have magnesium deficiencies, you aren't making these neurotransmitters properly, and that is causing issues in your sleep. Or let's say you have patients that, as I was stating before, might have an issue with the melatonin or the valerian, then you can give them magnesium. Right now, the exact mechanism behind magnesium and how it regulates sleep is still yet to be determined, but it is currently believed that facilitating sleep because it's a GABA agonist. And as I mentioned before, it is also responsible for those enzymatic reactions. There's actually 300 enzymatic reactions that is essential for creating neurotransmitters. Now, how would you dose this for your patients? There was a study that was conducted, and they used a dosing of 500 milligrams of magnesium oxide. That is a form of magnesium. They use this twice a day for 8 weeks, and this increased sleep time, sleep efficiency, serum melatonin levels, and then it decreased their insomnia severity index score, also decreased their sleep onset latency, and decreased serum cortisol levels. So let's say you tested their HPA levels or their adrenal, you did an adrenal assessment with them, and they had serum cortisol levels elevated in the evening time. Magnesium would actually be a great supplement for them to help decrease those cortisol levels so their melatonin levels can increase naturally for them. So magnesium is going to be a great supplement to have in your toolbox when you are working with patients who have sleep issues or insomnia.
Yes, wonderful. And on the screen, you can see the particular study that Dr. Chill was referring to with the use of magnesium that was found to increase the sleep time, the effectiveness, the efficiency of sleep, and levels of melatonin. So that's another way, magnesium, and you can read more about it in this study. So we love looking at studies because we get so much more about the safety profile, the effective, the indication, what dosage they should use. And then, as usual, we always recommend to you professional grade supplements because we don't want patients to buy off shelf where the quality control is not there in most cases. We want to make sure they get professional grade supplements. So this was a really interesting, I feel like this was a super, super interesting and very important discussion that we have today. And hopefully by now you already have understanding of the three major factors that contribute to insomnia. There are more factors, and we dive a lot more in depth into each one of those factors in the Functional Medicine Advanced program. And then we talked about the 3 major supplements, so you can start winning with your patients when they come and complain about insomnia, they're tired during the day, and all of that, right? So we want to make sure that we, as usual, we provide you more clinical tools. So this was a pleasure. And next week we're having a special training. So next week we're talking, we have a discussion about leaky skin, leaky gut, and histamine reaction that leads to skin condition. That's going to be super important. And then we have a special close event for our community members in the Functional Medicine program and the Functional Nutrition program. That is talking about fibromyalgia. So that's like a 2-hour special class with Dr. Caviola on Monday. So that's going to be a very, very interesting topic as well. And as usual, I want to thank Dr. Chill for being here, for preparing everything, and sharing his experience with us all. So,
thanks for having me. It's always a pleasure. I love doing this.
Yes. And as usual, we really appreciate all of you for being here, for taking the time and investing in growing your skills and bringing the best of comprehensive care to your patients. So keep on learning, keep on growing those skills. Let's transform those patients' health. And as usual, take care for now. And we're going to see you in our next class.
Hi, everybody.
Still there?